Dear viewers, welcome you all to our show, OSA, that is also the Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance with each other. Dear viewers, today our topic is role of Elizarov and Hexapod in polio and post-polio syndrome, a very important topic. As we all know that polio is a very difficult challenge for all orthopedic surgeons. So how we can manage the post-polio syndrome by Elizarov, that will be discussed today. And the honorable speaker is the highly academic person, Dr. Suresh Kumar Bhola sir from Haryana, India. I would like to request Dr. Suresh Kumar Bhola sir to join with us. Sir, good afternoon
Thank
and
you,
welcome.
thank you very much, sir. I am really grateful to Professor Berry, Professor Novikov, Dr. Shamal Sulhuda, and Dr. Ashraf for giving me opportunity to share my work. Dear friends, I am also thankful to you because you have spared time to listen to me. And
Thank you.
it is not a presentation only, it is His blessings and 16 years of faith and surrender of these patients who are suffering from polio and post polio syndrome. Dear
Thank you, sir. Thank
friends,
you very much. Before starting your presentation, I would like to welcome our academic expert in our program, sir. Now, I'd like to request our honorable academic expert, that is Professor Mofakrul Baris, sir, the legendary Elizarov surgeon from Bangladesh. Professor Mofakrul Baris, sir. Welcome, sir. Welcome to our show.
Thank you very much. Good afternoon, everyone.
Good afternoon, sir. And we have another academic expert from Kurgan, Russia, Professor Novikov, sir, the highly academic person from Kurgan, Russia. Novikov, sir. Sir, welcome, sir.
Good afternoon, dear friends. Good afternoon.
Good afternoon, sir. And the another one is Dr. Shamsul Huda, sir, from Patna, India. I'd like to request Dr. Shamsul Huda, sir, to join with us.
Thank you and good afternoon, Dr. Tanvir and Raj TV.
Thank you very much. Dear viewers, now I'd like to request our honorable speaker, Dr. Suresh Kumar Bhola, sir, to share his screen and start his presentation. Dr. Suresh Kumar Bhola, sir, would you please share your screen and start your presentation, sir, please.
thank you very much. Thank you very much, Professor Berry, Professor Nevikov, Dr. Shamal Huda, and Dr. Ashraf for giving me opportunity to share my work on polio and deformities in polio from Bhola Hospital, Kushetra. Dear friends, this is just not only a presentation, but it is His blessings. 16 years of faith and surrender of these patients who suffer from polio and post-polio syndrome. And it is a journey which I will like to share. In the treatment of polio, we started from plaster, moved on to Elizarov, and then to Hexapod. Earlier, as you can see, we used to apply plaster to correct flexion deformities of the knee. But with the plaster, you can overcorrect it, you can undercorrect it, you can also create certain other planes, mal orientations or mal alignment, like varus, valgus, rotational issues, which could not be checked with the help of plaster. So we moved on to Elizarov, which was very precise, but the problem was hinges. That problem was solved with the help of Hexapod. Now, for many years, we are using Hexapod to correct these deformities, and many of them, as you can see in the screen, in the lower limb, we are using it for knee, leg, ankle, foot, all in one go to correct different deformities so that we can save the time of the patient. We daily come across such kind of patients in our OPD who are suffering from polio, like this young girl, another girl who is having polio She says she's having shortening of 2 centimeters. They have problems, but they have different problems. He's another young person. He says he's unable to bear the weight now, and he says he's unable to walk few steps, and he thinks he will be on wheelchair after some time. So another person, he is 47 years of age. He has come to me. Can you do anything so that I can walk better? Another girl who has never touched the ground with the involved lower limb and uses 2 sticks. She also comes. Whether you can do anything for me? Dear friends, you keep on seeing these patients in OPD. And like this, hand on the thigh, very common gait in poliotic patients. Another patient with hand thigh as well as lower limb length discrepancies. She wants, can you address both the limb length discrepancy as well as hand of the thigh? She is almost walking normally without hand thigh. She is very well compensated. Should she be operated? He is a doctor by profession. He is 29 years of age. He wants to walk on the hanging lower limb without the help of any stick. These patients who almost daily come across in the OPDs. He is another patient who is wearing caliper as well as using stick. She is another girl sorry, who is having bilateral involvement. Almost whole of the weight is being borne by the by use of 2 crutches by upper limbs. She is 38 years old lady, hand thigh gait. So these are different kind of presentation which almost every orthopedic surgeon come across. He is 59 years of age. He has also come. Can you improve my gait? Can you do something for me? Dear friends, what we do, we advise them vitamin D, B12, calcium,
Постоянно
prescribe
пропадает.
certain analgesics, physiotherapy, yoga, AFO, KFO, caliper. Most of the time, patient will not turn up again because he knows we don't have much to give to them. Another question, very important question, which we have forgotten to ask, and it took me about 8 years to start asking this question: are you deteriorating? And to my surprise, more than 70 to 80% of the patients, they said yes, they are deteriorating day by day. And it was a gradual deterioration in most of these cases. What is the diagnosis of this? What is the importance of this line? The importance is we have reached from post-polio deformities to post-polio syndrome. We are now dealing not with post-polio deformities, we are dealing with post-polio syndrome. What is this? This is a condition which affects polio survivors years after the recovery from an initial acute attack, and there is now weakening of the muscles which were previously affected by the polio and even which might not be earlier affected. Literature says there's nothing much effective pharmaceuticals or other treatment for syndrome, and a number of control studies they have demonstrated that non-fatiguing exercises are the only solution. I have observed that 70 to 80% of the polio patients are now suffering from post-polio syndrome. And what do they complain? They say the number of steps is decreasing. maybe for last 1 year, 2 years, 3 years, 4 years. The strength in the lower limb is decreasing. They cannot stand for more time. Earlier there was no hand thigh gait, and now there's hand thigh gait. They start falling down. There's fear of fall, and there is fatigue, back pain, bending while walking. So different patients might have one or more than these symptoms. Whenever these patients they come, I advise them surgery. I advise them surgery if I think and I am confident that I can give him a better energy efficient gait. Dear friend, the biggest challenge is opinion which is discouraging them to undergo surgery is by saying by other orthopedic surgeons or other persons that you might deteriorate. Somebody is befooling you. Muscles which die in polio cannot be recovered. Do not get operated. Wear calipers. Try to learn and live with this. Do not challenge it. Yes, dear friend, these persons are partially right. Muscles which die in polio, they cannot be recovered. 100% right. But there appears bends in the limbs. Once they are corrected, the patient can be made functionally aligned to make the gait more energy efficient. And what will the benefit of the surgery? There is increase in the number of steps he is walking in one go. The strength is increasing. He can stand for more time. Hand thigh gait is off. Hand is off the thigh gait. There is less fatigue. Dear friend, polio surgery is for functional improvement of the patient. It is not for looks. And the principle of this is if any object which is gravity friendly, they do not need any support to stand. Another thing which is major contributor in the treatment I like to share that foot and ankle deformities they are most apparent, obvious. They are seen, analyzed very early by the patient, public, and the surgeon. Like in this lady, everybody will say there's equinus cavus. But dear friends, knee is hidden partially, but can be seen from all the sides, like foot and ankle, if extra effort is made. If extra effort is made, you will see, like in this lady, there is knee flexion deformity. The hip is almost hidden from the eyes and mind of both patient and the treating surgeon, and it cannot be seen from all the sides. Like in this, there is flexion deformity even at the hip. But if you ask, everybody will almost say, yes, she is having equinocavalvarus, treat it. What we are adding day by day, we are adding day by day. Earlier we started with plain X-ray. Then we started with full length X-rays. Then I purchased my Apple Mac so that I can use Horos software to find out what are the angles. Now we are using 3D CT scans. We want to see what kind of deformities we are going to deal with because the deformities, they are not at one level, they're at multiple levels. And now we are preparing 3D models. If you see someone seriously, you will treat it seriously. Dear friends, I think polio deformity correction is mother of all the deformity corrections because multiple lower limb joints they are involved, maybe both sides they are involved, muscles are also involved. There is no research, no literature, and it is dynamic worsening. Post polio syndrome, day by day, this deformity is worsening. Last but very important is non-glamorous job. Most of the time, your job, your work will not be neither appreciated and like this. I like just share with you this 27-year male who is having post polio deformities. He wants to walk without any stick. Very big challenge for me. And we did muscle charting, X-rays, 3D CT scan. Where's the deformity? The deformity is in the left lower limb. Is it at bone, joint, soft tissue, muscle, or all? It is in all. Is it at head, hip, thigh, knee, leg, foot? Yes, it is at all the levels. Will we correct it in acute or gradual way? We'll treat it partially, acutely, rest of this gradually. So we did flexor abductor release, hamstring release, lateral popliteal nerve release, tensor fasciae release, and then applied the fixator, Elizero. And this is the clinical picture at 3 months when we are treating different deformities of the lower limb with the help of hexapod. The patient has started learning to bear weight on a limb which was never used for weight bearing. This is intertrochanteric osteotomy. At the end, intertrochanteric osteotomy has united, and this full extension which has been achieved in the knee without any varus or valgus. So, dear friends, now he can walk without the help of a stick and almost full weight bearing on the involved lower limb. I'm thankful to his courage because he surrendered and it took me about 7 months. Dear friends, you cannot even recognize who is the person who is having any deformity in 5 persons who are standing here. Another person, he is 27-year male. He was operated upon earlier for some leg lengthening, which was done about 13 years back. These are his full length X-rays. You can see the kind of hip he is having. I have never seen such a kind of hip which is so badly deformed with all muscles involved. So, dear friends, we can do here osteotomies around the knee. HTU can be part of in this patient. It can be part of multiple malalignment syndrome. These are syndromes. Most of the patients in polio are suffering from syndrome. What is that syndrome? At multiple level, multiple bones are involved, and they are having malalignment at different levels in all the planes. So the treatment revolves around correcting these malalignments. Like this is frontal plane X-ray, and we find there is valgus at the upper end of the tibia. Also, the plateau of the tibia upper end is reversed. So we have deformities in the upper end of the tibia at least in 2 planes. The femur, that is also deformed because PDFA is only 59. So it is also giving flexion to the involved lower limb. There's soft tissue contracture. There's hip involvement. There are muscle weakness of both the lower limbs, and there is short. So these are the problems which have to be solved. They can be solved to some extent in single go. Rest will be solved after 2 years, 3 years. So you can see, once we corrected the deformities, this is almost well aligned lower limb. These are the osteotomies which have united intertrochanteric, supracondylar, HTO, and he can walk instead of using out of the 4 limbs, 3 limbs he was using. Now he's using 2 limbs. It's a big thing. You just ask anybody who's having hand-thigh gait. It is not only dream, it is a new birth to them to walk without, he's not having any caliper. And another interesting case, a young person, 28-year male, he was a poliotic. We can treat it by plating, nailing, traction. But if you're a deformity correction person, you know the polio, you will come to know there is flexion deformity of the knee. So you can resolve both of them, the fracture of the shaft of the femur and FFD of the knee by doing a extension osteotomy. This is support for the fracture. You see how well aligned it is. And this is a calculation for the supracondylar osteotomy, extension time. So both they have united in a period of time of about 3 months. There's no implant which is left in the body of this patient, and we have successfully treated his fracture as well as removed his deformity. So this is the benefit of knowing the deformities. If you know something, you like to treat that. These are the final X-rays. The fracture has united, align, and extension osteotomy that also has united. Dear friends, earlier we used to treat these patients with only Ilizarov. And she is a girl who had never touched the ground with the involved lower limb, so much flexion at the hip, at the knee. And these are the X-rays after 1 year. These are the pictures, walking videos, 14 years after the initial surgery. There is no caliper, there's no stick, and she can walk without the help of anything. She's an inspiration to my work. Supracondylar osteotomy has been done in this along with lengthening at the supracondylar osteotomy level. Equinocavus. Before treating any equinocavus, you must treat knee flexion deformity. Otherwise, you will worsen. The patient will stop walking. Another hand-thigh gait. During treatment with hand-thigh gait, you have to be very cautious that in the post-operative period, like in the middle slide, now you can treat any varus, any valgus, any overcorrection, any undercorrection. And if the patient is off the hand, on the thigh, during treatment, then he will be off the thigh even after it. If we carefully see, he's not touching the floor with the involved lower limb. The whole weight is being borne by the stick. And this is after the treatment. There's a lot of difference between first slide and second slide, and she's walking, her walk is much more energy efficient. He's just picking up his lower limb, hardly any muscle which can be transferred from one place to another place, and he's starting learning how to walk with Ilizarov on, without hand on the thigh. He's using stick, caliper. This is post-operative. There's a lot of difference with the caliper on the limb with deformities corrected. It is a very energy efficient gait. Then caliper with deformities, which is a very ugly and very strenuous kind of gait. Now we are treating these patients with the help of Hexapod. These are all patients you can see very carefully in certain period of their treatment we have used it, and still it is on, and we can use it for the knee, supracondylar knee, soft tissue, and HTO, supramalleolar, foot correction, ankle corrections, multiple of them, they can be used. And dear friends, we are just hand-thigh gait, equino, cavo, and no caliper post-operatively. He's learning how to walk. The length issue is still there, which we will resolve later on. She's hand-thigh gait, and you can see Hexapod still on the lower limb, and afterwards no hand-thigh gait. My wife, she says satisfactory discharge of a polio patient from the hospital after 3 to 4 months is just like bidai from Mayaka. That means parental home to her husband home. Once these patients, they go satisfactorily, and then they send videos. She has sent me the videos after 4 months of the operation. She is using two calipers, two crutches during the post-operative period, no crutch. And after 4 months of the initial surgery, she has sent me the videos without any. She came from United Kingdom and went happily after the treatment. And this is, I practice at a very small town, Kurukshetra. And for me, it is the matter of very big proud if a patient comes from so far off place and get treated. These are the pre-post X-rays. And today, I am calculating all the angles in frontal and sagittal plane on CT, 3D CT. And I'll show you how to do this in another sometime, because that is a big lecture, 20-30 minutes. You see how they have been collected on the frontal plane. Similarly, we calculate them on the sagittal plane. She's so, dear friends, we are committed to improve the life of polio patients, hand-thigh gaits, age, sticks, and at all levels, knee, foot, ankle, leg. And you see how he is just picking up the lower limb for walking, and it is 8 years after. No caliper, no stick. And just, he's a doctor by profession. There's no caliper, there's no stick, there's no special shoes. Carry home messages post polio syndrome is very commonly seen, most neglected, undiagnosed, untreated entity. But it can be treated, friends. We say polio has been eradicated. See, there's no one in the corridor. Just wait. Just see while going on the roads, in the crowds, in the towns, on the bus stands, on the railway stations. You will start looking. They are there. These patients are there. Polio has been eradicated. The patients still have the deformities. They want treatment. The corridor, which was almost empty, is full of patients. They all need treatment at knee level, foot level, ankle level. And please listen to them in future and guide them properly. I am really thankful to all of you who have spared time to listen to my work on polio and polio deformities. These are all the patients who are who are under treatment for polio and post-polio syndrome with the help of Elizro and Hexapol. Thank you very much for your kind attention. Everybody, please.
Thank you very much, sir, for your excellent and magical presentation. As we all know that Elizarov is just like a magic, and our honorable speaker, Dr. Bhola sir, already shown us the magic of Elizarov in case of post-polio syndrome. Now, I would like to request our honorable academic expert, Professor Novikov sir, to say something regarding our presentation today. Professor Novikov sir, would you please?
Dear colleagues, Suresh Bhola, thank you
Thank
very
you.
much. Thank you very much
My pleasure.
for your experience. Спасибо огромное от русских врачей за то, что вы используете наш русский метод. Thank you for your brave. Why? Because this is true. This is not our bread. Polio, this is neurologic side. And very interesting.
Thank you, sir.
Little bit we change angles, little bit we change weight bearing, and we change level of life. All of muscles after surgery like before, but when surgeon through Magic Elizarov change biomechanical principle of weight bearing, patient go to from handicap through normal. I can say this is normal life, and today you show excellent results. And I think this is another side when after simple lengthening, when after simple correction, doctor will touch, this is heavy, very deep neurologist pathology, doctor, orthopedic surgeon will go to the another of level of experience. Thank you from my heart and from Elizarov Center.
Thank you very much, sir. Words from a person of your stature, they mean a lot to me, sir. Thank you very much, sir. Thank you very much.
Thank you, sir.
Good.
Thank you very much. Now, I'd like to request Professor Mofakrul Bari sir to share his knowledge regarding the post-polio syndrome treated by Elizarov. Professor Mofakrul Bari sir, would you please, sir?
Okay. Thank you. Thank you very much.
Thank
My
you very
friend,
much, sir.
Bola.
Thank you very much, sir.
Everything. So, you know, I heard you lecture several times,
Thank
and
you, sir.
I am amazed whenever you are doing with the very difficult cases,
Thank you.
especially the post-polio syndrome. You rightly showed everything, and I've always learned from the mistakes and from the juniors and from the seniors. Even then, I'd like to tell you that I also tell if you work with the easy problems, if you work with the impossible problems, if you work with the difficult problems, whenever you are doing it easy problems, this is a boring, easy life. Difficult, difficult, you'll get satisfaction. And impossible things, the patients and the relatives of the patients, they'll remember you forever. So, you know, in my country, late cases of polio deformity syndrome we are getting, and I get satisfaction, especially the ladies, young girls, that means 20, 25, and 30 years old. Whenever you are making, they are walking with your hand knee gait or head thigh gait, and we are doing this very simple operation, supracondylar osteotomy, just changing the position, and they can easily walk without the support of the hand. This is the beauty, this is the beautification. And you don't need to go for open plating a screw, nothing. You have shown rightly with Elizarov, using the biocompatible thin wires and with the hexapod. And today, from the core of my heart, I'd like to congratulate you that you have joined with our this Raj TV and Ortho TV from Shamsuludda and our Tanveer Ashraf. And whenever I have heard your name, he told me, "Oh, fantastic! Allow him in, and we'll talk and we'll learn again." And thank you so much for your beautiful deliberation, beautiful cases. So this is amazing. Thank you again from our.
Thank you very much, sir. Thank you very much, sir, from my heart that you have given me opportunity to share my work on your TV, and
This is the
you
learning
have
from everyone. Yes, learning from everyone. India,
Thank
Russia, and Bangladesh joining, and we are learning again. Okay, thank you.
right, sir. Thank you, sir.
Thank you.
very much.
Thank you very much, sir. Now, I would like to request Dr. Shamsul Huda, sir, to share his knowledge regarding this post-polio syndrome.
Thank you, Dr. Tanveer. Dr. Bhola has been my mentor, my teacher since ages. I have learned a lot from him. I've been taking guidance in many cases from Baris sir, Bhola sir, and I have learning from him. I've done a few cases of lengthening over nail and polio cases. It has given wonderful results. And I really request Bhola sir to give us permission to come and do some fellowship under him, so that we learn more and can do some more cases. Thank you, sir. Thanks a lot, sir.
Definitely. Hope Bhola sir will accept your request and offer you a fellowship within a very short time. As Professor Baris sir has given us this scope, you already know that Professor Baris sir has given us the 2 fellowship, you and me, to
Yes,
work under his demonstration. It's a great day, sir. It's a great day, as because of Professor Bhola sir, Professor Novikov sir, and Professor Baris sir is in the same screen, and I myself, Dr. Tanveer Ashraf and Dr. Shamsul Huda bhai, learning from this legendary Elizarov surgeon. And it's a great day, definitely for us, for Raj TV, and definitely for Ortho TV. And I would like to give thanks to Raj TV for helping us to arrange this type of academic program, and definitely Renata Pharmaceuticals Limited, Bangladesh, for sponsoring our program. Dear viewers, we will meet in the coming Friday in Orthopedic Solution Academy with a new magical topic with Elizarov. Till then, I'm Dr. Mohammad Tanveer Ashraf. Would like to say bye-bye to all of you. Bye-bye.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe.